Hello, Mrs. Umble. My name is John. I'm a nurse at Ephrata Community Hospital, and I'm going to today be performing an assessment on you of your heart, your lungs, and your abdomen. So first, I'm going to start with the cardiac or the heart assessment. I'm going to start just by inspecting your chest. I'm going to note any sort of pulsations, which I do not see any. I will note, though, that in a clinical setting, I would also check the PMI, or the point of maximal impulse, just to see if there was a pulsation, and that is normal for there to be a pulsation there. So moving forward, I'm going to auscultate or listen to your heart sounds. And as I go through the different sites that I'm listening to, I'm just going to let you know what I'm listening for. Okay? So first, I'm going to start here on the right sternal border in the second midclavicular space. And this is where you will hear the aortic valve. And now I'm going to move over to the second intercostal space on the left sternal border. And this is where you will hear the pulmonic valve. I'm going to move down to the Erb's point. Okay, and now if I can just have you lift up your left breast for me here. I'm just going to try to listen to the fifth intercostal space, left sternal border. This is where you hear the tricuspid valve. And then I'm going to move over to the PMI. This is the fifth intercostal space, and this is in the left midclavicular line. So I had initially listened to all of those spots with the diaphragm of my stethoscope, and I will now go back through with the bell of my stethoscope, listening for a lower frequency in sound, which could show me that you would have a murmur in one of those heart valves. So I'm going to ask you to lift up your breast for me again. I'm going to listen for a murmur in the aortic, or I'm sorry, the mitral, the tricuspid, okay, I'm going to listen for the pulmonic, and the aortic. Okay, very good. Now I did not hear any signs of any murmurs, and I did hear S1, S2 sounds, which is the lub-dub, as you know. I would like to just say that on the top two portions here, I heard S2 the loudest, and it is easiest to hear S1 on the bottom 2 points there, the mitral and the tricuspid. So now, as I'm listening for murmurs, I do actually need to put you in the left lateral position. This is the best way to listen to a heart murmur. So I'm going to go ahead and do that now. Okay. So now we have you in the left lateral position here. This is the optimal position for us to listen to your mitral valve to hear if there's any sort of murmurs. So I'm going to auscultate here the fifth intercostal space, left midclavicular line. With the bell of my stethoscope, and I, again, did not hear any sort of murmur, which is very good. Now that we auscultated for a murmur in that mitral valve in the left lateral position, I am now just going to take a look at your neck. I'm going to note for any jugular vein distension, which I do not see here, or any sort of pulsations in your carotid arteries, which also I do not see. So next I'm going to palpate your carotid arteries one at a time, and I'm going to note the strength. The strength is +2 for both, which is normal. We don't want the pulse too weak or too strong. And also I did not feel a thrill. A thrill is a vibration that if there was any sort of occlusion or plaque buildup, it would cause that vibration. So that's a good sign to us that you might have some atherosclerosis or plaque buildup in your carotid arteries. Next, I'm going to auscultate those arteries, which I'm listening for a bruit or a turbulent blood flow. So what that would also show is if there's any sort of occlusion or any plaque buildup, you would hear like a whooshing sound rather than just a normal beat. So I'm going to listen here bilaterally to both carotids. Good. And I will note that I listened to those bruits with the bell of my stethoscope, and good for you, we did not hear any bruits. And that is it for the cardiac assessment. So now we're just going to move right along to the respiratory portion of the assessment. I'm going to start just by taking a look at you. I've kind of been doing this during the assessment. I'm going to note your respiratory rate. I'm going to note that you're not hyperventilating or hypoventilating. I'm going to look at your rhythm. You're breathing nice, very rhythmically. You're not irregular. I'm also noting the depth and the effort that you're putting into your breathing. I see that you don't take really deep breaths, really shallow breaths. You're not using any accessory muscles to breathe, which is very good. I'm also going to note your position here. You are you have good posture. You're not tripoding, what we call it. A lot of times when people are short of breath, a posture is a very good indication that they are not breathing as well as they should. And then finally, I'm just going to, again, note your chest for any pulsations or masses or anything abnormal, which, again, I do not see. So the next test I want to do is called chest excursion. So chest excursion is measuring the symmetry of your chest as it expands when you breathe. So I am going to put my hands on your chest here. If you can just take a nice deep breath in and out. Very good. I'm going to do this again. Very good. So what I'm looking for there is that your chest, both sides are expanding symmetrically. If there was some sort of restriction, there would be an abnormality there, but for you, your chest expanded symmetrically, which is exactly what we want to see. So now I'm going to move to the back here, and I'm going to test something called tactile phrenitis. I'm just going to get you to say the word 99 a couple times, and I'm going to feel the vibrations in your back. What I'm listening for, or what I'm feeling for, is that I'm feeling nice vibrations that are symmetrical per lung, and that they do diminish posteriorly. So if you can just say for me, 99.
99.
And again.
99.
And again.
99.
Awesome. So in that test, I did note that the vibrations diminished posteriorly, and that there was no abnormalities from right lung to left lung. So I did feel the same vibration in each lung. And also, while I'm back here, I am just also going to test whispered pectriloquy. Whispered pectriloquy is a test that, it's very similar to tactile phrenitis. I'm going to get you to whisper 99. And I'm going to do the same thing. I'm going to listen as you say it, going down your back. And really what this is trying to test for is if there was any scar tissue, like an infiltrate, if there was fluid buildup in your lungs, in certain areas, it would be louder. The vibrations would travel through them, and you would be able to identify that there was some sort of, something in your lungs causing the vibrations to be louder. So if you can just whisper 99 for me.
99.
Okay.
99.
Okay.
99. 99. 99.
Awesome. And I didn't hear any abnormalities from left to right lung or anterior to posterior. Okay, so I did that. So now what I'm going to do is I'm going to auscultate your lungs. So I'm going to listen to all your lung fields. I'm going to note that in the front here, I'm going to listen to bronchial noises right over your trachea. Bronchial noises just show very turbulent, fast, large volume of air, in your trachea. And then I'm going to move down here right to the left and right of your sternum, where we would hear bronchiovesicular sounds. Bronchiovesicular is where, the bronchial tree, your trachea comes down and it branches off and it fills in your lungs. So in that area where those bronchial tree kind of open up into your lungs, it's going to be a little bit, you're going to hear a higher pitch noise than just the bronchial. And then finally, in all of these other chest areas, is vesicular. So that's just like healthy lung tissue expanding, the alveoli, the smallest part of the lung, and that's going to be a much higher pitch noise. There are bronchiovesicular noises in the back that I can hear, but just for this assessment, I'm just going to listen to the bronchiovesicular in the front, and then vesicular in all other areas, okay? So I'm going to start with the front here. If you can just take a nice deep breath for me. Very good, and again. And one more time. Okay, so those were the bronchial. Now I'm going to listen to the bronchiovesicular. And again. Very good. So now I'm going to listen to the vesicular. Very good. So now I'm going to move into the posterior, and I'm going to also listen for those vesicular breath sounds. And I know it's hard for you to see on the video, but I did listen to 10 different spots. Starting high, going low, it did spread out to get to each of the bottom parts of the final rib, which is where the lungs do stop past the 12th rib. So now I am also going to listen to lateral lung sounds, 4 on each side here, alternating. Very good. Very good. Okay, so now for this portion of the video, I am just going to have you turn around here to face the camera. Okay, so now what we're going to be doing is I'm going to be percussing your lungs here. So what I'm going to be doing is just tapping on my finger on your back to create a sound that's going to hopefully resonance through your lungs. The sound is going to be like hopefully, what we're trying to listen for is a nice hollow sound. You know, just like you would tap on like a hollow container, you would hear that hollow resonance. So I'm going to start here on your back, on your upper back here, listening for resonance. Very good. So now I'm going to continue to move down your back here, listening in all your lung fields. Very good, and that's the percussion portion of this assessment. Okay, so now we're going to do the abdominal part of the assessment. First, I'm going to look at your abdomen, noting for the contour. I'm going to note that you do have a flat stomach. I'm going to note that your stomach is symmetrical. I'm going to note that you don't have any lesions on your stomach, that you don't have any abnormal masses. So now what I'm going to do is I'm going to auscultate. I'm going to listen to all your bowel sounds. It is normal for your bowels to make some noise every 5 to 15 seconds. So I'm going to start here in the right lower quadrant. Okay, so now that I listened to your abdomen, I did note that all your quadrants were normoactive, which is a healthy amount of movement in your bowel. I am also going to auscultate here your aorta, listening for the same thing that I did before, the bruit, which could be a sign of atherosclerosis or plaque buildup. And I do not know a bruit, so now I'm going to move to the renal arteries, the right renal artery, and the left renal artery, which again I do not hear. I'm going to listen for the left iliac artery and the right iliac artery, and then finally the femoral, the right femoral, and the left femoral. Listening again for any bruits or turbulent blood flow that would indicate to me that there's some sort of occlusion in those arteries, which I do not hear any. Next thing I'm going to do here is I'm just going to palpate. Let me know if there's any sort of pain or tenderness. I'm also noting for any masses or lesions that I feel that are abnormal. It is common for you to be able to feel the liver and the spleen underneath the rib cage if you press hard enough. But I do not feel any masses or pulsations, which is awesome. So that concludes the abdominal part of the assessment, and then we can move on to the vascular assessment. So really what I'm going to be doing here is just looking at your extremities. First, what I'm going to do is I'm going to inspect. I'm going to look at your nails. I'm going to note that they are strong, that they are not abnormally shaped. I'm going to take a look at your skin. I'm going to note that it's warm. You do not have a tenting turgor. Your elasticity is normal on both sides here. I'm going to note that your hair is slightly distributed throughout both arms here. No abnormalities there. I'm going to note that the color is acceptable for ethnicity. No abnormalities with color. So now, what I would like to do is I'm going to assess capillary refill. Now you do have nails on, so I'll just use the tissue around the nails. And I'm going to note that your capillary refill is less than 3 seconds, which is what we want. If you had some sort of peripheral vascular disease, your blood vessels might not fill up as quickly. So that would be one of the signs to us saying that you do have poor blood perfusion in your fingers. So the capillary refill in both hands is less than 3, which is awesome. So now what I'm going to do is I'm going to assess your different pulses. There's 3 different pulses in your arms. I'm first going to start with the radial, the most common here, right by your thumb. I'm going to note that is a +2, and I'm going to note that that is a +2 bilaterally for the radial pulses. I'm going to note that the ulnar pulse, now which is on the other side, which is pinky side, I'm going to feel that. And I am going to note that that is a little bit weaker than the radial. That is about a +1, which it is easier to find the radial than the ulnar. So now finally I'm going to take a look here right at the crease of your elbow here, your antecubital. And I'm going to note the brachial is on the pinky side, and I feel that, and that is a +2, which is very good. And it's a +2 bilaterally, which is awesome, which is what we expect. Okay, so now we're going to start with the lower extremities here. We did the upper extremities. So first I'm going to take a look at your nails. I'm going to note again the strength, note that they're not brittle, note that they're not abnormally shaped, which they are not. I'm going to note your skin. I'm going to note that the color is correct for ethnicity. I'm going to note that you do not have any hair here on your legs, as I suppose you shaved. And I'm also just going to note that I don't see any lesions or masses. So everything's looking good here so far. So now what I want to assess is your capillary refill. I'm just going to press down on your nails here. And I'm going to note that the blood returns to your tissues in less than 2 seconds, which is what we want. Same with the upper extremities. Very good. So now I am going to feel your pulses again. I'm just going to lift your leg up here, and I'm going to feel the popliteal, which is behind the knee. Very good, which that is a +2. Feel your other popliteal pulse here, which is a +2. I am now going to move on to the posterior tibial pulse, which is on the inside of your leg here, right behind your tibia. And that is very good. That's a +2. And I'm going to do the same for your right side here. That is a +2. And finally, I'm going to feel your pedal pulse. Very good, which is a +2. I also did not note any sort of edema during this assessment or any swelling in your legs, which is very good.